After 60, have you noticed your legs getting weaker? Do you need to push off your knees just to stand up? Does climbing stairs feel like lifting weights? Sometimes you might even lose your balance just walking across the living room. Most people think this is simply aging, but here is the truth. It is actually one of the first signs of sarcopenia, age-related muscle loss. It happens silently, with no pain or swelling, until one day you cannot get up from a chair without help. But here is the good news. 3 essential vitamins, yes, just 3, have been shown to help restore leg strength in just a few days. No heavy workouts, no expensive therapy. Just the right nutrients at the right time. In this video, you will discover the 3 key vitamins every senior needs, how deficiency leads to weak, heavy legs, and how to combine them for rapid recovery safely and effectively. This is not hearsay or health gossip. It is backed by real research, clinical studies, and decades of expert experience. Stick with me until the end. I will also show you a daily vitamin routine most people overlook, but it works wonders. After 60, your body begins a slow but steady transformation. Your bones become more brittle, your circulation slows, and your muscles, especially in the legs, start to shrink. What most people do not realize is that the legs are usually the first to lose strength, and when that happens, even basic movements like getting up or walking become a challenge. According to the American Geriatric Society, adults over 60 lose 1 to 3% of their muscle mass every year, even if they are eating normally and feeling okay. That means in just 5 years, you could lose up to 15% of your leg strength without even noticing it. So why does this happen? There are 3 main reasons. Reason 1, vitamin deficiencies. As we age, our stomachs produce less acid and our gut absorbs nutrients less efficiently. This leads to low levels of vitamin D, vitamin B12, and vitamin B1. All of which are essential for muscle contraction and nerve communication. Reason 2, poor blood circulation. Slower circulation means your legs get less oxygen and fewer nutrients. The result is heavy, tired legs, frequent cramping, and early fatigue. Reason 3, reduced physical activity. Many seniors walk less or avoid stairs, which gradually causes leg muscles to weaken and shrink. Even with nutrients, muscles cannot rebuild properly. The good news is by replenishing these 3 missing vitamins, your legs can regain strength in just a few days. Let us now dive into each vitamin and see exactly how they work, starting with the one most seniors are missing. Vitamin D3 is the switch that reactivates leg strength. Did you know that vitamin D3 is not just another vitamin? It acts more like a master switch, reactivating your entire muscular, skeletal, and nervous system. Here's the problem. After the age of 60, your body becomes much less efficient at producing this vital nutrient. Your skin becomes thinner, you spend less time in the sun, and your liver and kidneys, key players in converting vitamin D, start slowing down. As a result, your body begins to shut down essential systems. Your muscles become weak, your legs feel heavy, your movements slow, and most concerning, your balance begins to falter. All because you are quietly missing one simple nutrient, vitamin D3. Why is vitamin D3 so essential? Vitamin D3 helps your body absorb calcium, critical for keeping your bones strong and stable. But that is just the beginning. It also ensures your muscle fibers contract properly, helps your nerves send signals smoothly, and most importantly, it prevents muscle loss, which happens silently as we age. Without enough D3, your body becomes like an old machine, sluggish, underpowered, and unreliable. How to tell if you are lacking vitamin D3? You may notice signs like weak legs, especially when climbing stairs, fatigue after standing or walking, nighttime leg cramps, poor balance when turning or stepping quickly, and deep aches in your hips, knees, or heels. In some people, it can also cause mild anxiety or irritability and trouble sleeping at night. These subtle signs are often mistaken as just aging, but they are actually early warnings of vitamin D3 deficiency. What does the science say? At the University of Birmingham in the United Kingdom, researchers studied seniors over 65. After just 5 days of taking 800 international units of vitamin D3, participants showed an average 19% increase in leg strength. Another study from China found that seniors who supplemented D3 along with light exercise significantly improved leg power and balance within just a few weeks. At Harvard's Geriatric Research Center, researchers noted that older adults with low vitamin D3 had a 40% higher risk of falling or being hospitalized than those with healthy D3 levels. The message is clear. Vitamin D3 does not just protect your bones, it protects your independence. How does it work? When you restore healthy D3 levels, your body absorbs calcium more effectively, stimulates the growth of new muscle fibers, improves muscle contraction and reaction time, and reduces hidden inflammation in muscle tissue, making movement smoother and less painful. In simple terms, vitamin D3 turns your muscles and joints back on. How much should you take? Experts recommend for healthy adults over 60, 800 to 1,000 international units per day. For those with clear signs of weakness or past falls, 1,500 to 2,000 international units daily under medical supervision. Always take vitamin D3 in the morning or early afternoon and after a meal with healthy fat like eggs, salmon, or olive oil for better absorption. Never take D3 late at night as it may disrupt your sleep. Can you get enough from food? Unfortunately, not easily. Let us look at the numbers. A 100-gram serving of salmon provides about 500 international units. One egg gives you only 40 international units. A glass of fortified milk has around 100 international units. To get 1,000 international units from food alone, you would need to eat fatty fish, eggs, and drink milk every single day, which is not realistic for most seniors. That is why supplementing with vitamin D3 is often essential. Who should consider supplementing right away? If you are over 60, spend little time outdoors, feel unsteady or have fallen before, have been diagnosed with osteoporosis or joint pain, or follow a plant-based diet with limited dairy or fish, then vitamin D3 should be your top priority. A few important cautions. D3 is generally safe, but too much for too long can cause problems. Taking more than 4,000 international units a day for extended periods may lead to nausea or constipation, kidney stones due to high calcium levels, headaches, or irregular heartbeat in sensitive individuals. The key is this: use the right dose at the right time and monitor your levels regularly. Vitamin D3 is the foundation for regaining leg strength in older adults. It is the switch that reawakens your muscle systems that have quietly slowed over time. When taken correctly, you may begin to feel the difference in just a few days. Lighter steps, stronger legs, and more confidence with every move. Vitamin B12 restores balance, nerve health, and leg confidence. Let us talk about vitamin B12, one of the most overlooked yet most essential nutrients for anyone over the age of 60. You may know B12 is a vitamin that helps with energy or memory, but what most people do not realize is this: B12 plays a critical role in how your brain talks to your muscles, especially your legs. It keeps your nerves healthy, your movements coordinated, and your reflexes sharp. When B12 levels drop, the connection between your mind and your muscles becomes fuzzy, and the first signs often show up in your lower body. What happens when you are low on B12? If your B12 levels fall below optimal, you might notice symptoms like tingling, numbness, or burning in your feet, weakness in your legs, especially when standing or walking, a sense that your legs are asleep or not listening, difficulty maintaining balance even on flat ground, and feeling unsteady or needing support to walk. Some people also experience mood changes, mild depression, brain fog, and forgetfulness. These signs often sneak up gradually, so many seniors mistake them for just getting old. But in reality, they are textbook symptoms of B12 deficiency. Why are seniors more likely to be deficient? There are two main reasons. 1. Poor absorption. As we age, our stomach produces less acid, especially if you take acid-reducing medications like omeprazole or ranitidine. This low-acid environment makes it harder to extract B12 from food. 2. Limited diet. B12 is found almost exclusively in animal products like meat, fish, eggs, and dairy. If you eat less meat or follow a mostly plant-based diet, you are at higher risk. Even if you eat well, your body may simply not absorb enough. That is why B12 deficiency is so common after 60. What does the science say? There is strong research showing how low B12 affects mobility in older adults. A study from Oxford University in the United Kingdom, researchers followed over 1,000 seniors aged 65 plus and found that those with low B12 levels walked slower, had significantly poorer balance, and were more than twice as likely to fall in the next 12 months compared to those with normal levels. Journal of Gerontology Clinical Trial. A randomized study gave seniors 1,000 micrograms of B12 daily for 8 weeks. After supplementation, participants showed improved reaction time, better lower body strength, and fewer complaints of numbness and instability. B12 does not just sharpen your mind, it helps your body stay upright and in control. How B12 works in your body. Vitamin B12 supports myelin sheath production, the protective coating around your nerves. This allows fast, accurate signals from brain to muscles. It also supports red blood cell formation, improving oxygen delivery to muscle tissues and energy metabolism, so muscles get the fuel they need to perform. When B12 is missing, your nerves misfire, your muscles misinterpret commands, and your legs start to feel disconnected. Who is most at risk of B12 deficiency? You are more likely to be low in B12 if you are over 60, take acid blockers or antacids regularly, follow a vegetarian or low-meat diet, have diabetes and take metformin, have digestive issues like irritable bowel syndrome or gastritis, drink alcohol regularly, or have had gastrointestinal surgery like weight loss surgery. If this sounds like you, it is worth checking your B12 levels with a simple blood test. Signs that often go unnoticed. Some people do not feel the classic numbness or tingling. Instead, they experience clumsiness or dropping things, mild headaches, fatigue that does not improve with rest, and random aches or buzzing sensations in their feet. These are all red flags your body is trying to send, and the earlier you respond, the faster you recover. How much B12 should you take? For adults over 60, a daily dose of 500 to 1,000 micrograms of methylcobalamin is both safe and effective. Why methylcobalamin? It is the active form of B12 your body can use right away without converting it. This is especially helpful for seniors since conversion slows down with age. You can take it as a sublingual tablet that dissolves under your tongue, as a chewable, or even as a spray. Best taken in the morning or with lunch, and ideally not with coffee or tea, which can hinder absorption. Can you get enough from food alone? In theory, yes, but in practice, it is unlikely. Here is how much B12 is in common foods. Beef liver, 3 ounces, about 70 micrograms. Salmon, 3 ounces, about 4.5 micrograms. Eggs, 1 large, only about 0.5 micrograms. Milk, 1 cup, about 1 microgram. That means you would need to eat liver every day or large amounts of fish and dairy to meet your needs. For most seniors, a supplement is the more realistic option. Is it safe? Vitamin B12 is water-soluble, which means your body flushes out any excess. It is extremely safe, even in high doses. There is no known toxic level of B12 in healthy adults. However, always check with your doctor if you have chronic kidney issues or are taking blood thinners. Otherwise, for most people, supplementing B12 is one of the safest and most effective ways to boost energy, improve nerve function, and restore leg control. Real stories, real impact. Many older adults report feeling more stable when walking, regaining sensation in their feet, standing up more confidently, and even sleeping better once their nerve symptoms calm down. All thanks to a nutrient most of us forget about. Vitamin B12 is not just a brain vitamin, it is a movement vitamin. It reconnects the lines of communication between your brain and your body. And when those lines are clear, your muscles respond faster, your legs feel stronger, and your confidence returns. If you have been struggling with leg weakness, strange sensations, or balance issues, do not ignore it. Check your B12 and give your nerves what they've been waiting for. Vitamin B1 is the hidden key to muscle energy and anti-fatigue power. By now, you have learned how vitamin D3 strengthens your muscles and how vitamin B12 helps your nerves communicate with your legs. But there is one more piece to the puzzle, and that is vitamin B1, also known as thiamine. If D3 turns the lights on and B12 connects the wires, then vitamin B1 supplies the electricity, the actual energy your muscles need to move. Without it, your muscles simply cannot function. Even if your bones are strong and your nerves are sharp, without B1, your body runs out of fuel. What is vitamin B1 and why is it so important? Thiamine, or vitamin B1, plays a central role in energy metabolism. That means it helps convert the food you eat, especially carbohydrates, into usable energy called adenosine triphosphate. Adenosine triphosphate is what powers every muscle contraction, every movement, every breath. Your legs, being the largest muscles in your body, require a constant supply. When B1 is low, your muscles fatigue quickly, feel heavy, and recover poorly after any movement. Signs that you may be low in vitamin B1. Here are the early symptoms many people over 60 report. Legs feel weak or dead tired even after minimal activity. Muscle cramps, especially in the calves or feet. A heavy, dragging sensation when walking. Feeling short of breath when climbing stairs. Occasional dizziness or low energy after standing up. Some may also feel mental fatigue, poor appetite, and a general lack of motivation to move. These are classic signs of a slowing metabolism at the muscular level, and B1 often plays a big role. Why do seniors become B1 deficient? There are several reasons. 1. Decreased absorption. As we age, our digestive system becomes less efficient at absorbing thiamine from food. 2. Medication use. Diuretics, commonly used for blood pressure or heart issues, flush out B1 through urine. Metformin and antibiotics can also interfere with B1 levels. 3. Alcohol consumption. Even small amounts of regular alcohol use like wine or beer can impair B1 absorption in seniors. 4. Poor diet. Many processed foods are stripped of B1, and if you are eating fewer whole grains or legumes, your intake may be too low. What does the research say? Tokyo University Study, 2021. A study of 300 elderly adults found that over 30% had low B1 levels, and these individuals walked more slowly, reported frequent muscle fatigue, and had significantly lower leg strength. After B1 supplementation, most showed marked improvement in energy, walking distance, and stair climbing. Journal of Neurological Sciences study. Patients with chronic leg fatigue were given 100 milligrams of thiamine daily. After 7 days, 82% reported better endurance, 68% had reduced leg pain and heaviness, and none experienced side effects. How does B1 help your legs? Vitamin B1 powers the Krebs cycle, your body's core energy-producing process. This allows your muscle cells to generate adenosine triphosphate quickly, recover faster between movements, and maintain tone and strength throughout the day. B1 also supports nerve signal transmission, especially in the peripheral nerves that control your feet and legs. Without B1, it is like trying to drive a car with no gas. Everything works, but nothing moves. How much B1 do you need? The recommended daily amount is small, just 1.2 milligrams for men and 1.1 milligrams for women. But for older adults with symptoms, much higher doses are often used for therapeutic effect. 50 to 100 milligrams per day is safe and commonly recommended by doctors for seniors with fatigue, leg weakness, or nerve issues. The good news is B1 is water soluble, so any excess is safely flushed out in your urine. Best time and way to take it. Take B1 in the morning as it helps boost energy during the day. Always take it with food, ideally one that includes some protein or healthy fat. Avoid taking it with coffee, black tea, or alcohol, as these can interfere with absorption. Can you get B1 from food? Yes, but you have to be intentional. Great sources of B1 include whole grains like brown rice or oats, legumes like lentils and beans, sunflower seeds, and pork and organ meats. But the truth is, most seniors do not eat enough of these foods daily, and some medications or conditions block absorption. So if you are not sure, or you have felt unusually tired lately, a supplement may be the safer bet. Who should consider supplementing B1? If you feel leg fatigue even with light activity, take diuretics, metformin, or acid-blocking medications. Have type 2 diabetes, drink alcohol regularly, or have had unexplained weight loss or loss of appetite, then your B1 levels are worth checking or simply restoring with a safe daily dose. Is it safe? Yes, thiamine has no known toxicity even in high doses and is considered one of the safest supplements for older adults. That said, if you are on medication or have liver or kidney concerns, always speak to your doctor before starting high-dose B1. Real-world results. After just 3 to 5 days of taking B1, many seniors report increased energy, legs feel lighter, walking becomes easier, stairs are not as exhausting, and the desire to move and be active returns naturally. It is like adding fuel to an engine that had been sputtering for years. Final thoughts. Vitamin B1 may not be flashy. It does not get as much attention as D3 or B12, but for older adults struggling with energy, muscle fatigue, or leg heaviness, it can be the missing piece that changes everything. It powers your muscles, it restores your drive, and it helps you move through your day with strength, purpose, and ease. If you have felt drained, dragged down, or disconnected from your body, do not overlook B1. Sometimes the smallest nutrients make the biggest difference. How to combine these 3 vitamins for maximum results. Now that you know how vitamin D3, B12, and B1 each support your muscles in different ways, the next question is, how do you take them together for the best effect? The answer lies in timing and keeping things simple. First, let us talk about when to take each vitamin. Vitamin D3 is best taken in the morning right after breakfast, especially a meal that contains healthy fats like eggs, yogurt, or a bit of avocado. Why? Because D3 is fat soluble and needs fat to be properly absorbed. Vitamin B12 works best around lunchtime or early afternoon. Taking it too late might interfere with your sleep, since B12 also supports alertness. Avoid taking it with coffee or tea, as these drinks can block absorption. Vitamin B1 is your morning fuel. Take it with your first meal of the day, ideally a balanced breakfast with some protein and whole grains. It will help support energy levels throughout the day and even improve mental focus. Here is a simple daily example. Breakfast: 1 boiled egg, a small bowl of Greek yogurt, 1 capsule of vitamin D3, and 1 tablet of vitamin B1. Lunch, grilled salmon or tofu, steamed vegetables, and 1 tablet or lozenge of vitamin B12. This setup gives your body the right nutrients at the right time in the right combination. What about multivitamins? If you are already taking a multivitamin, check the label carefully. Make sure it includes proper amounts of D3, B12, and B1, because many senior formulas underdose these critical nutrients. Also keep in mind, some multivitamins combine water-soluble and fat-soluble vitamins together. So it is still best to take them with food, and ideally in the morning or at lunch, never on an empty stomach. Final tip: more is not always better. Stick to recommended doses and always talk to your doctor or pharmacist, especially if you are taking medications or managing a chronic condition. When taken properly, these 3 vitamins work together like a well-oiled machine, restoring strength, balance, and energy to your legs and to your life. Warnings and safety tips when taking vitamins. Vitamins are powerful tools for restoring health and energy, but like any tool, they must be used wisely. So before you rush to the pharmacy, here are a few important safety tips to keep in mind, especially if you are over 60. First, do not increase the dose on your own. Just because something is natural does not mean more is better. Taking double or triple the recommended amount will not give you faster results, and in fact, it might cause harm. Vitamin D3, for example, is fat-soluble. If you take too much over time, let us say 4,000 international units or more per day without supervision, it can raise your calcium levels too high. This can lead to kidney stones, constipation, nausea, or even confusion. Second, watch out if you have liver or kidney problems. These organs are responsible for processing and clearing excess vitamins from your body. If they are not working well, even normal doses can build up and cause side effects. So if you have been diagnosed with chronic kidney disease, fatty liver, or any other major condition, talk to your doctor before starting new supplements, especially fat-soluble ones like D3. Third, some vitamin side effects are easy to miss. For instance, high doses of vitamin B6 when taken for months can cause numbness or tingling in your hands and feet. It is rare, but it happens, especially with unmonitored overuse. Excess vitamin D3 can cause headaches, poor appetite, or muscle cramps long before serious problems appear. Always pay attention to subtle changes in how you feel, especially if they appear after starting a new vitamin. And finally, get your blood levels checked. If you are taking D3 or B12 long-term, it is a good idea to do a simple blood test every 6 to 12 months. This helps confirm you are in the safe and effective range, and not accidentally over or under supplementing. Bottom line, vitamins can absolutely improve your quality of life, but the key is to be smart, informed, and cautious, especially as we age. Used correctly, these 3 simple nutrients can transform your strength, mobility, and independence. Let us take a moment to review. If your legs have felt weak, heavy, or unreliable lately, it is not just age, it is not your imagination, and more importantly, it is not irreversible. We have seen how vitamin D3 strengthens your muscles and bones, vitamin B12 sharpens your nerves and balance, and vitamin B1 recharges your energy and endurance. Together, these 3 simple vitamins form a powerful trio, one that can help restore your confidence, your strength, and your ability to move freely again. But here's the key. You have to take the first step. Whether it is adding a morning supplement, checking your blood levels, or talking to your doctor, action beats waiting every single time. And now I would love to hear from you. Have you ever tried any of these vitamins? Did you feel a difference in your strength, your balance, or your overall energy? Share your story in the comments, because the more we learn from each other, the stronger we become together. Thank you for watching. Take care of your body. Nourish your legs and keep moving forward, one strong step at a time.